Good afternoon and welcome to the Congressional briefing on the urgency of addressing physical activity during and after the pandemic. This briefing, brought to you by the Physical Activity Alliance, is in partnership with the Active People Healthy Nation Partner Network. Today, we're going to discuss the toll of COVID-19 on health, the importance of the U.S. Department of Health and Human Services and Centers for Disease Control and Prevention appropriations for physical activity, and the need for investments in active transportation and physical activity in transportation reauthorization and infrastructure spending. As a quick reminder, this briefing is being recorded. I'm Graham Melstrand from the American Council on Exercise, and I serve as a board member for the Physical Activity Alliance, and I'm honored to introduce our speakers. Our speakers today will be Mark Fenton, a nationally recognized public health, planning, and transportation consultant. He's an adjunct associate professor at Tufts University, an advocate for active transportation, and the former host of America's Walking on PBS television. He's consulted with the University of North Carolina's National Center for Safe Routes to School and the Pedestrian and Bicycle Information Center. He's led training and planning processes for pedestrian, bicycle, and transit-friendly designs and policies in communities across the United States, Canada, and Australia. Much of his work as a technical assistance provider to communities was funded through CDC and other healthy community grant programs. He studied engineering and biomechanics at the Massachusetts Institute of Technology and at the U.S. Olympic Training Center. He's previously served as the manager of Human Performance Laboratory at Reebok and has published numerous articles and books related to physical activity promotion, community interventions, and public policy. Ken McLeod is the policy director at the League of American Bicyclists. He leads the Bicycle Friendly State Program and data.bikeleague.org. He provides technical assistance to advocates working on state and local initiatives and manages public policy initiatives to improve bicyclist safety through vehicle technology and other traffic safety advances. Ken joined the League in 2012 after graduating from William and Mary School of Law and is a licensed attorney in the state of Virginia. Katie Adamson is the Vice President of Health Partnership and Policy for the Y of the USA, which is the National Resource Office for the nation's 2,700 YMCAs. She provides guidance and consultation on healthy living policy, partnership and program strategies at the national level, and for local Ys in the state alliances of the YMCAs. She helps develop and advance healthy living legislative and advocacy strategies at the state and federal level, assisting with congressional, corporate, and health partnerships. She has over 27 years of experience in health policy, partnership development, strategic planning, in the nonprofit, private, and government sectors. And our first speaker today is Dr. Rachel Levine. She serves as the 17th Assistant Secretary for Health for the U.S. Department of Health and Human Services, where she fights every day to improve the health and well-being of all Americans. She's working to help our nation overcome the COVID-19 pandemic and builds a stronger foundation for a healthier future, one where every American can attain their full health potential. Dr. Levine's storied career, first in academic medicine and as a physician, then as Pennsylvania's Physician General and Pennsylvania's Secretary of Health, is focused on the intersection between mental and physical health, often treating children, adolescents, and young adults. Please welcome Dr. Rachel Levine.
Well, good afternoon. Thank you so much for that introduction, and it's a pleasure to join you for this briefing. We have clearly faced a very difficult and challenging year. The COVID-19 pandemic has caused really tremendous suffering for millions of Americans. And during this pandemic, all of us have felt the strain. I'd like to talk first about the state of physical activity in the United States. At the Department of Health and Human Services, we know that physical activity is one of the best tools that we have to help combat chronic diseases experienced by over half of all Americans. Even before the pandemic, far too many people struggled to incorporate physical activity, regular physical activity, into their daily lives. Socioeconomic disparities, lack of opportunities for safe play, and limited access to programs are just some of the inequities that have impacted physical activity. And these have been further exacerbated by the pandemic. In 2018, HHS released the second edition of the Physical Activity Guidelines for Americans. The guidelines recommend that adults get at least 150 minutes per week of moderate to vigorous aerobic physical activity and at least 2 days a week of muscle strengthening activity. Youth, ages 6 to 17, need at least 60 minutes of moderate to vigorous physical activity every day. However, data shows that before the pandemic, less than 1/4 of American adults met the guidelines for both aerobic and muscle strengthening activity, and only 1 in 5 adolescents got at least 60 minutes of activity every day. Further, Americans were sedentary approximately 7.7 hours while awake. Less than 1/4 of American adults used active transport, such as walking or biking. And only 58% of youth, ages 6 to 17, participated in team sports or took sports lessons. Now, on this last statistic, it's important to note that large disparities exist in youth sports participation. For example, our most recent pre-pandemic data showed that only 49% of girls in high school participated on at least one sports team, compared to 60% for boys. Only 46% of non-Hispanic Black youth and 50% of Hispanic youth participated in a sports team or a sports lesson, compared to 66% of white youth. Only 41% of youth from low-income households played sports, compared to 76% of youth from high-income households. And only 39% of youth who identified as gay, lesbian, or bisexual played on at least one sports team, compared to 58% of heterosexual youth. Our work to increase physical activity levels has become even more critical as people across the nation have faced unprecedented challenges and disruptions to their routine in the last year due to COVID-19. Recent research suggests that physical activity has been decreasing even more during the pandemic. Now, in regards to physical activity and health outcomes, the more that we can make regular physical activity a part of our daily lives, the better off both we and our nation will be. Some benefits from physical activity can help us cope with the stress of the pandemic. A single bout of activity has immediate effects with improved mood, sharpened focus, reduced stress, and improved sleep. The guidelines tell us that some physical activity is better than none. Lots of activities count, even those that don't seem like physical activity, such as household chores. And the more physical activity that one does, they lead to more health benefits. For adults and older adults, health benefits, both mental and physical, include lower risk of cardiovascular disease, hypertension, type 2 diabetes, multiple forms of cancer, fall-related injuries, anxiety, depression, dementia, including Alzheimer's disease, as well as improved cognition, quality of life, sleep, bone health, and physical function. For youth, health benefits include improved bone health, weight status, cardiorespiratory and muscular fitness, cardiometabolic health, cognition, and reduced risk of depression. Youth who are active in sports experience even more benefits, such as higher levels of self-esteem and confidence in their abilities, reduced risk of suicide and suicidal thoughts and tendencies, improved life skills such as goal setting, time management, and work ethic, opportunities to develop social and interpersonal skills such as teamwork, leadership, and relationship building, and improved concentration, memory, school attendance, and academic performance. Now, in terms of our office, the Office of the Assistant Secretary for Health, our office provides leadership and guidance on physical activity on behalf of the federal government. The Office of Disease Prevention and Health Promotion coordinates this work within OASH. Our physical activity portfolio includes the Physical Activity Guidelines for America, which provides evidence-based recommendations to help Americans maintain or improve their health through physical activity, and serves as a critical resource for health professionals and policymakers. The Move Your Way campaign, which encourages people to meet recommendations from the second edition of the Physical Activity Guidelines and understand how to fit more physical activity into their daily lives. The National Youth Sports Strategy, which provides a framework to create safe, fun, inclusive, developmentally appropriate, and accessible youth opportunities for youth. The President's Council on Sports, Fitness, and Nutrition, which provides a slate of high-profile and disciplined, diverse, quote-unquote, fitness ambassadors who can extend the reach of the government's efforts to communicate the health benefits of physical activity and good nutrition. Each of these programs support physical activity work happening across the federal government. For example, the guidelines and the Move Your Way campaign are integrated into the CDC Active People, Healthy Nation initiative, which provides a blueprint for building active communities and aims to get 27 million more Americans physically active by 2027. Our mission at Health and Human Services is to enhance the health and well-being of all Americans. Physical activity is key to both our mission and our long-term recovery and resilience as a nation in the wake of the COVID-19 pandemic. Physical activity enhances our mental health, our physical health, and social health, all aspects that we must improve to become more resilient to future public health threats. However, to truly achieve resiliency as a nation, we need to create equitable access to physical activity and sports opportunities, including access to safe spaces, low or no cost programs, and inclusion for all individuals, regardless of race, ethnicity, sex, sexual orientation, gender identity, religion, disability, or neighborhood. And we know that we need trusted partners like those here today to help create a more active America. All sectors of society have a role to play in making it easy for everyone to integrate physical activity into their lives through sports, recreation, active transportation, worksite wellness, education, and more. Thank you so much for your attention, and I'm pleased to answer a few questions.
Dr. Levine, thank you so much. We do have two questions for you from the physical activity community. The first is, what investments will Health and Human Services be making after COVID-19 to address the health gap, the increasing rates of chronic disease and associated risk factors, especially physical inactivity?
Well, we believe that youth sports provide a great way to help our kids get through the pandemic and beyond. We have met with community leaders in youth sports sector through virtual workshops to discuss how to overcome the challenges of the pandemic and support the mental, emotional, social, and physical health of youth, both during and after the pandemic. Another way we're encouraging physical activity for youth, but for adults as well, is through the Move Your Way campaign. We're currently working with the Chicago Park District to conduct a Move Your Way pilot program to encourage teens to get your 60. And we've recently released new campaign resources to encourage families to get together. Throughout COVID-19, the campaign has been responsive to safety concerns, and we've had to adjust our messages and strategies to align with local, state, and federal guidelines to prevent the spread of the pandemic.
Thank you for that. The second question, you mentioned the physical activity guidelines for Americans. So for the mid-course update for the physical activity guidelines for Americans in 2023, would you contemplate focusing on the intersection between infectious disease and chronic disease and the impact of physical activity in addressing both?
Well, there's a lot of interest in this subject, but the published data on the specific relationship between physical activity and infectious diseases is limited. Now, we know that physical activity is good in general, but we're asking the question about the relationship between physical activity and infectious diseases. Further, the mid-course report has historically expanded on the most recent edition of the physical activity guidelines. For example, the mid-course report for the first edition of the guidelines looked at physical activity in youth. Since the second edition of the guidelines did not look at the relationship between physical activity and infectious diseases, it'd be challenging to address this through the mid-course report. But we do plan to examine physical activity in older adults for the mid-course report, along with strategies and settings which can help older adults get ready for more activity. But we are very interested in the research about physical activities and infectious diseases such as COVID-19. There are some recent studies. There was a recent study from Kaiser Permanente, which showed that consistently meeting federal physical exam guidelines was associated with decreased odds for severe COVID-19. And there are some other papers as well. So we're going to need to look at the research, and if the evidence becomes clearer, we will address that, although probably not in the mid-course report.
Thank you so much. Thank you very much for participating today.
Well, thank you so much. It was a pleasure to be here.
Our next speaker is Mark Fenton.
And
Hello all, this is Mark Fenton, and I believe we're waiting for a video to queue up here based on the Dangerous by Design study that was recently released by the Complete Streets Coalition of Smart Growth America. And I think it is queuing up right now. But if we have difficulty with that, we'll jump right to my, my presentation. I think we're gonna hold off. I will just let you know that again the publication that video was based on was called Dangerous by Design, and it talked about the horrible toll that we pay every year in this country, roughly 40,000 to 50,000 total motor vehicle deaths, and on the order of 5,000 to 6,000 pedestrian deaths. And we've seen that number rising over the last decade fairly consistently. And it's a really heartbreaking story told in that video about a family that was devastated by pedestrian deaths in Philadelphia. If we are unable to show that, I'd urge you to find that online. You could easily Google that, and it's well worth it. Again, my name is Mark Fenton. I'm with Tufts University, and I'm a public health planning and transportation consultant, and I have the great privilege of working with lots of communities that are funded by both transportation dollars in this country and public health dollars around the question of building environments for more routine physical activity, as Secretary Levine alluded to. And in particular, this image is sort of the rhetorical question that I'll ask and try to answer, which is, what would it take to make this be the norm? This is a woman who's dropping off a kid for school, not in a line of cars, but from her bicycle. And she's certainly the outlier right now, but what would it take to make that the rule rather than the exception? And I'll make three basic points with the next slide here. Number one, telling people to exercise enough is not enough. We have pretty good evidence that simply encouraging physical activity is not sufficient for the vast majority of Americans. We need to build environments where they can get activity routinely. We do have some evidence from the pandemic that Americans were asking for that. As you know, lots of folks were asking. The one thing we could do was get outside, and if we could walk or ride a bicycle at safe social distance. So there seems to be some desire out there. And when we do design communities, as the images on the right show, for active transportation, we tend to see what is being called the triple bottom line, which is not just public health benefits, but economic and environmental benefits. And so those 3 points really sort of underpin all that you're going to hear us talking about and make the case for today. Is very clear that what Dr. Levine said is pretty well known in American society. We know we should be physically active, but most people have the image of one of these pictures: exercise, going to the gym, taking a class, training for a marathon. And they forget that the picture in the lower right here is relevant. This gentleman is just riding his bike for errands. That's not a very fancy bike. He's not wearing Lycra. He's not out for an exercise ride. You can see the bag over the handlebars. And routine physical activity counts toward that 150 minutes that the secretary alluded to. And we know it can be quite sufficient. and in particular, for some of our most challenged members of the community, people who can't afford a membership at a club to take classes, being active as a part of daily life is a wonderful opportunity. Unfortunately, most of us are not. As she said, we are not meeting the physical activity guidelines, and many people will point to screen time, the amount of time we spend either recreationally or in our work in front of screens. But the reality is we built a transportation system, picture on the lower left here, that leaves pedestrians and bicyclists really on the outside. You can see the little arrow there, the little circle, two pedestrians trapped in the median island in a sea of motor vehicles, or a river, I should say, of motor vehicles. Or the young lady in the lower right picture here, riding her bike to school. Again, she's the outlier, she's the exception, not the rule. The rule is all those cars lined up in front of the school. And that's not just an anecdote. On the next slide, you can see the data that actually shows us how dramatically that has changed just over the last 50 or 60 years. In fact, if you just look at the time window from about 1970 to 2000, the percentage of kids walking and bicycling to school dropped from over 40% to only about 15%, while the percentage of kids being driven to school by car went from something like 15% to almost half. That's a dramatic reversal. It happened in just 30 years. And what's amazing is that's the same 30 years, as you see on the next slide, that's the same 30 years over which childhood obesity rates tripled. Now, that's not a coincidence. As we've gotten in the habits of putting ourselves and our children in the car for every trip, we've reduced our routine physical activity. It contributes to that 7+ hours of sedentary time every day that the secretary alluded to, and it has tremendous manifestations in the form of overweight, cardiorespiratory disease risk, type 2 diabetes, hypertension. And indeed, in 2015, as a result, the Surgeon General of the United States combined combed over 350 articles that made the case that we can't just tell people to exercise, we actually have to promote environments for it as well. In fact, it's called the Surgeon General's Call to Action to Promote Walking in Walkable Communities. And the fundamental conclusion is we need physically active routes to everyday destinations. We need people to be able to walk to the store, walk a child to school, ride a bike for errands, walk to transit. Indeed, when we allude to active transportation, I want to be crystal clear that transit is a part of that, because there are any number of studies that show routine transit riders get more daily physical activity, are more likely to get that 150 minutes a week. Well, that's the good news. Here's the bad news. I've been doing this work for over 25 years. I've been leading walk audits and workshops in communities all over the United States. You're just seeing a handful of the photos from, I've worked in literally all 50 of the states. I must say I'm an abject failure. As you see on the next slide, the vehicle miles traveled in this country have just been rising inexorably over these many decades. Indeed, the only downturn in total vehicle miles traveled was about the time of the Great Recession, when gas got to $4 a gallon and the economy really slowed down. But even at that, in the next slide, you can see that as we came out of that recession, it looked like we were going to continue to get back on the same track, and we were going to just continue to drive our cars more, walk and bike less, until something big happened. And you see it on the next slide. Last spring, suddenly vehicle miles traveled plummeted, right? It dropped off the edge. And of course, that's when we shut down the economy with the opening of the pandemic. Now, no one would have wanted it to happen this way. It's been a horrible tragedy, but there is a lesson in this, because as we go to the next slide, you see we saw highways literally empty in cities across the country. You could get this photo on the left at rush hour in cities from the East Coast to the West. The picture on the right is quite compelling indeed. There was a hidden public health benefit, I hate to admit, because it's a horrible way to have gotten it. But those are measures of nitrous oxides over the major cities of the Eastern Seaboard. The top picture is the last 4 years combined on average, and then the bottom picture is just last spring. And you can see this tremendous improvement in air quality, drop in pollutants, just by virtue of the reduction in the motor vehicle traffic. Now, again, nobody would want it to happen that way, but it does give us a lesson that maybe we should be looking more clearly at our transportation habits and what we're going to do. The other thing that happened during the pandemic is people did get out and begin to move under their own power, recognizing that was really their only option. But they really wanted places to do it with safe social distancing. The picture in the top right is from Denver, Colorado, where they created what they call slow streets. Cities and towns across the country were doing things like widening or adding new bicycle lanes, or even temporary bike lanes, or simply encouraging people to get out on the infrastructure they already have. The beautiful Beltline Trail down in Atlanta saw a tremendous amount of physical activity, people walking and bicycling. And they didn't tell people not to do that because we know of the health benefits of physical activity. Instead, we just said, let's do it. The pictures in the lower left there are the pictures that they put out that said, look, go out and be physically active, just maintain safe social distancing, wear your masks and so on. And what's encouraging about that is it suggests that Americans got a glimpse into what the possible is. Now, here's the interesting thing. On the next slide, I'm going to tell you a story. We've been doing this work for many years. Those of us promoting bicycling and walking, this is from a workshop way back in 2015 in Whitefish, Montana, where we went out and did one of those walk audits. We asked parents, would you let your kids bike to school? They said, we're not sure. We said, what if we created a protected bicycle lane? And they said, maybe. So as part of the Safe Routes to School funding they created a safe, temporary protected bicycle lane. And as you see in the picture on the top. And they proceeded to fill the schoolyard with bikes, as you see in the picture in the bottom. So even the hesitant parents said, if we created a protected space for our kids to ride, we might do this. We might let our kids ride or walk to school on a regular basis. And we've got lots of these examples of low-cost interventions that we could increase bicycling and walking. One result in Whitefish is they've gone on to build quite a compelling network of bicycle and pedestrian facilities that was precipitated by that trial, that demonstration. And I'm going to say that the funding made available through our transportation authorizations are critical to getting this stuff built. It may be the public health work that creates the community workshop and the walk audit and the temporary bike lane, and then the transportation dollars that actually puts it on the ground. On the next slide, I'm going to show you a very simple example of what's called a road diet. This is in Urbana, Illinois, where that 4-lane road during a routine repaving was converted to a 3-lane road that is 1 lane in each direction with a central turn lane. Now, the engineers did that to actually make it safer for cars, because now cars aren't turning left across 2 lanes of oncoming traffic. They aren't stopping in a travel lane. They're moving into the center turn lane. But if you look closely, you'll see there are now bicycle lanes. There's a nice safe median island for pedestrians are crossing. There are bus pullouts in the top of the picture there for transit riders. The point is, those improvements served all 4 users, the pedestrian, the bicyclist, transit, motor vehicles. It made a more complete street at relatively modest expense. They were repaving anyway, so it was not that costly. An important reminder here, some of the best dollars we can spend are on active transportation because they are not always very, very costly projects, but they are very, very impactful. So I want to leave these images in your mind and suggest we have learned over the time we've been doing this work that as we invest in active transportation and creating settings where it's safer for people to walk, to bike, to take transit, we are increasingly seeing communities reap the triple bottom line benefits of healthier people, but also healthier local economies as downtowns and main streets become more robust with the greater number of people the patrons who can come, not just those who can drive, but those who can walk and bike and come by transit, and the employees who can take transit to their jobs, the essential workers who are served by more complete transportation systems. And of course, the environmental benefits, right? Improved air quality, reduced traffic congestion, less stormwater runoff from giant parking lots. So everything I've set up to this point is really evidence-based. It's the evidence-based argument for investments in active transportation as part of our transportation funding going forward. But I'm going to tell you what my opinion is. If you said, okay, Mr. Travel all around the country, talk about walking and bicycling, selling the active transportation story, what would you do if you could write the budget for transportation? Well, here's how I'd do it. I'd allocate about 1/3 of our dollars to fix the existing roadway network, fix the highway infrastructure, the roads, all those bridges that need repair. I'd give 1/3 to transit. We know, and we saw during the pandemic, that our most essential workers and often our most disenfranchised members of the community, the ones who need transit the most, get the least. So let's reinvest in transit in a meaningful way so that the most underserved can have the transportation they need. And let's invest 1/3 in making walking and bicycling safer for absolutely everybody across the spectrum of age and income and race and ethnicity and ability and disability. Let's build a network for those who need it most. If we spend our transportation dollars this way going forward, I am quite convinced we would see that triple bottom line benefit of healthier people, healthier economy, healthier environment. And I'll close with this point. And some of you who know me and have heard me talk about this before, I've been saying this for quite some time. On my final slide, on my next slide here, you've probably seen this picture of my kids who are now 23 and 25, who I've frozen in time at 3 and 5, because back when they were youngsters in the early 2000s, we were seeing papers come out from like the New England Journal of Medicine here, a potential decline in life expectancy associated with all the diseases of sedentary lifestyle and all the afflictions associated with not being physically active enough. Well, here's the bad news. 2019, a paper was published in the Journal of the American Medical Association that said it's happened. That generation is now looking at a statistically shorter life expectancy than their parents. And we know that a huge contributor to that are the diseases of unhealthy lifestyle, and in particular sedentary lifestyle. We know we can do better, and we know that the funding for our health agencies and our transportation agencies together can be part of the solution. I thank you so much for the opportunity to visit with you. I look forward to continued discussion about how we're going to do better. And I'm privileged to turn it over to my friend and colleague, Ken McLeod, with the League of American Bicyclists.
And Mark, before we have Ken start, we did have a question from the audience.
Sure.
And the question is there a directory or website of available grants to fund programs to support overall physical activity in communities, especially in underserved or underrepresented communities?
I've got to admit that those grants and resources are still all over the place as best I can see it, but I'm happy to certainly help my colleagues that are on this call and combine the best that we have of that. Ken will also be able to speak to this, but the bottom line is we see stuff coming from the public health realm, we see stuff coming from transportation, we even see the role that local that local foundations play in their communities, as well as the national foundations. So I'm going to suggest that that's still kind of all over the place, and that one of the best things we can do is help communities find their way to those resources. And I'm happy to help do that because I think we'll make these slides available. And I think we should also do a compilation of the best we know about those kinds of resources.
Thank you so much. And if you would put the link to that video in, that would be very helpful.
Great, I'll do that right in the chat.
All right, Ken, please.
All right, thank you, Mark. Thank you, Graham. It's great to join you. I am Ken McLeod. I'm the policy director for the League of American Bicyclists. And the League of American Bicyclists is a national nonprofit building a bicycle-friendly America for everyone. We know that active transportation, people biking, walking, using wheelchairs and mobility aids, and using transit is an incredibly important part of keeping people physically active. And that's why we're proud to be part of Active People, Healthy Nation. The average bicycle commute is 19 minutes, meaning the person biking to and from work 4 days a week will meet their physical activity guideline for aerobic physical activity simply by their commute to work. And we know in recent years, and especially in the last year, we've seen more people biking and walking in their neighborhoods and in their communities for physical activity and transportation. Next slide. Congress has supported investments in active transportation for years. The flagship federal program for funding active transportation is the Transportation Alternatives Program. Since 1991, almost $16 billion in federal funding has been spent on biking and walking facilities, and most of that has come from the Transportation Alternatives Program. Under the FAST Act, the last transportation authorization bill, the Transportation Alternatives Program is in high demand, with applications easily outpacing the $850 million that's available each year. That's why we support the Transportation Alternatives Enhancement Act, which would increase funding, improve project delivery, and prioritize investments in low-income, transit-dependent, and other high-need areas. Next slide. While we know that physical activity can improve health outcomes, and we've even seen this impact when people who have contracted COVID-19, traffic violence keeps many from feeling safe being physically active in our nation's streets. In the last decade, people biking and walking have suffered disproportionately, with the number of people killed while biking and walking rising 35% and 50% respectively since 2009. Without significant changes to how America builds and operates its roadways, we can expect more than 300,000 people to be killed in the next decade. I hope you get an opportunity to see that video by Dangerous by Design and the National Complete Streets Coalition featuring LaTanya Bird's story. That type of story is all too common in America and too often reflects uniquely American challenges caused by how the United States built its transportation system and the ways that it makes vulnerable people more vulnerable through the transportation system that prioritizes motor vehicle speed over the safety needs of people biking and walking. The experience of the past year should strengthen our resolve to change. While the US saw a record increase in traffic deaths in 2020, peer countries in Europe saw record decreases. For the last decade, peer countries have had traffic fatality rates 2 to 4 times lower than the United States, and that gap is widening. To address this crisis, Congress should exercise leadership and change transportation funding to prioritize safety, equity, and active transportation. Next slide. As Congress considers the next transportation reauthorization, there are many opportunities to improve transportation safety, equity, and physical activity. I'm excited to present some of them to you. So we can build back right and build back safer with the Transportation Alternatives Enhancement Act, which will improve project and program delivery for the largest source of federal funding for active transportation with a focus on equity. The Complete Streets Act, which will improve safety by ensuring that federally funded transportation projects meet safety standards inclusive of all people and transportation modes. The Safe Streets Act will help states identify dangerous places for people who walk and bike and address them through the Highway Safety Improvement Program. This change is needed because despite dramatic increases in pedestrian and bicyclist deaths in the last decade, many states still fail to use the safety funding to improve conditions for people biking and walking. We can also improve routes to school through the Safe Routes to All Schools Act, which will ensure that high schools have access to this necessary funding to improve active transportation. And the Safe Routes to School Expansion Act, which will address equity by creating safer routes to school without a federal and local match requirement, so that we can have more projects that serve rural schools and schools in low communities with lower income, connecting them to better safety improvements. We can also connect more people to physical activity through investments and bills like the Connecting America Active Transportation System Act, which will strengthen active transportation networks through a focus on seamless and connected routes connecting communities and regions. And the Bike Share Transit Act, which will integrate physical activity into transportation by clarifying that bike share and scooter share are forms of transit, integral to providing first and last mile connections within the transit system. And then there's the Transit to Trails Act, which will promote equity by connecting underserved communities who lack park and recreation space to green spaces and public lands through transit. So Congress has a critical role to play in promoting active transportation through its support for the Active Transportation Alternatives Program since 1991. And looking forward, Congress has the opportunity to build on that legacy, making the investments needed to turn the tide on traffic violence in the United States and helping people be more physically active. Through the reauthorization and the investments in transportation from the American Jobs Plan, Congress can create safer, more equitable, and more active transportation system that will benefit all Americans. We're really excited to work with Congress to make that happen moving forward as an alliance. And now I'm happy to introduce Katie Adamson from the YMCA to talk more about building the capacity needed to help people be more physically active.
Hi, I'm Katie Adamson with the YMCA of the USA, and I am so pleased to have you guys here today. And I'm hoping that I can share some of the strategies you can help with to move us forward. The Y has been working for the last 15 years on our public health and transportation with our public health and transportation partners to move policies and systems forward that support physical activity where people live, learn, work, and play. So we're a proud national partner of the Active People, Healthy Nation Network, and we are joined by several of those partners here on the call today. In April of last year, the National Institutes of Health published an article that forecasted a very frightening prediction. They predicted that the two pandemics, one of COVID and one of physical inactivity, would feed off each other and make each worse. In other words, the pandemic of COVID-19 would contribute to physical inactivity, and physical inactivity would in fact make the COVID pandemic worse. Moreover, they said that the lasting effects of COVID-19 would not be fully realized for long after the pandemic ended. What we've learned today is that those researchers nailed it. The steep rise in inactivity and sedentary behavior has had a compounding impact on COVID outcomes, and the decline in physical activity is setting us up as a nation for steep increases in overweight and obesity among children and adults, and will likely lead to increases in chronic disease as a result. We are at a critical juncture here today. We need to assess the national ability to respond to the pandemic of inactivity and sedentary behavior. We need to recognize that so many of our communities lack access to environments that are safe, accessible, and supportive of physical activity and active transportation, and that those environments tend to be even worse in low-income communities and communities of color, communities that already experience worse COVID-19 outcomes. And I don't need to tell you that a year of stoppages and closures meant steep declines in cardiac rehab, physical education, recess in school, declines in sports and fitness, loss of activity via day, summer, or resident camp, and little to no biking to work or walking to school, and reductions in evidence-based programs with physical activity that address chronic diseases like cancer, heart disease, diabetes, and arthritis. And hours of Zoom calls and screen time meant sedentary behaviors increased, where kids and parents literally didn't move from their seats for hours at a time. Every single one of us has experienced this. This all compounded an existing pandemic of inactivity and sedentary behavior, and studies now tell us it's also leading to more depression, loneliness, and stress among youth and adults. We know that going into the pandemic, far too few Americans were getting the recommended amount of physical activity, which we heard from Dr. Levine. And we know that before the pandemic, physical inactivity was costing our nation $117 billion a year in annual healthcare costs. And we know that all of this is now worse due to COVID-19 and how it literally stopped us in our tracks. And today, CDC only has resources to support 16 of our states to advance policies and systems that will support physical activity and active transportation. CDC's Active People, Healthy Nation goal of getting 27 million more people active by 2027 will never be met without funding to all 50 states to support physical activity. CDC needs these resources to further advance the needed changes in our communities and states to end the pandemic of inactivity. We need Congress's help, and we need an aggressive response. We need Congress to invest in our ability to prevent and control chronic diseases. And many of us, in fact, have called on Congress to triple the chronic disease budget at CDC over the next 3 years. And today we're asking Congress to invest in strategies that support community environments that are walkable, bikeable, and rollable for everyone. According to CDC, and you heard from Dr. Levine, if we do this, we're going to help reduce chronic diseases, provide effective treatment for many chronic health conditions, including mental health conditions. We will see better school performance, and it can help close the achievement gap, and now what we're seeing, the health gap. And we will see improvements in our nation's military readiness. We can support local economies, decrease air pollution, and can create a more cohesive, socially connected community. We need Congress to provide $125 million to CDC, including $10 million for Active People, Healthy Nation, to support all 50 states in tackling this challenge and support communities in building an active America. This funding would allow for each state, plus the District of Columbia, to have resources for staff who are experts in promoting physical activity through community and state environmental changes that increase safe and convenient access to physical activity, especially for those populations most at risk of physical inactivity, things like master plans and safe routes to school initiatives. It would also allow states to promote nutrition security, especially for the youngest and most vulnerable populations. And it would allow states to support obesity prevention and management with linkages to the healthcare system and community-based organizations. The specific resources for Active People, Healthy Nation that we're asking for would allow states, municipalities, and local communities to leverage that expertise at the 50-state program to specifically address the populations who lack safe and convenient access to physical activity. This could include programs like implementing social support systems and networks to promote walking, especially among older adults, designing quick builds to change streets and allow safe walking and biking at the local level where health disparities are the greatest, such as developing plans for crosswalks so kids can walk safely to school, like Mark presented. Convening local groups to develop an action plan for promoting safe and convenient access to local parks, or taking steps to prioritize safety over speed in local and state policies. In addition to supporting CDC funding for physical activity, nutrition, and obesity, we need Congress to support regular appropriations for HHS updates on the physical activity guidelines that Dr. Levine mentioned. We support passage of Bipartisan Physical Activity Recommendations Act, which was introduced by Kind and McKinley in the House and Senators Brown and Wicker in the Senate. So I will end where I started. We know the lasting effects of COVID-19 will not be felt until long after the pandemic is controlled. But we've been given a warning about our future. Without deeper investments, aggressive investments in states and communities and our transportation systems, we will not be able to turn the tide on inactivity and sedentary behavior, and we'll most likely see escalating rates of chronic disease and healthcare spending. We hope very much that today's briefing helps you understand the strategies and resources necessary to get us moving again. So again, we ask for support for $125 million appropriations for the CDC, including $10 million for Active People, Healthy Nation, so that all 50 states and their communities can advance healthy, active community environments, and resources for HHS to review the physical activity guidelines and passage of the Physical Activity Recommendations Act. And now I'm going to turn it back to Graham. Thank you.
Thank you so much, Katie. So the Physical Activity Alliance is honored to be hosting the 2021 Congressional Physical Activity Challenge and wanted to recognize the early leaders in this friendly competition to promote physically active lifestyles. So as of today, the overall leading office is Senator Bernie Sanders' office. The leader in the House of Representatives is the office of Representative Michael Guest. And the leader of the individual competition is Jennifer D.C. from Senator Tim Scott's office. We wanted to say thanks to MyZone for providing the switch devices that are powering the challenge. And now we have a little bit of time for questions, and we appreciate that you've been sending those through here in the chat. For Mark, the question is, we have not had our DOT or MPO open to road diets during the routine repaving. They keep the 4-lane road to 4 lanes. What are arguments to change this or support during the road diet at the same time? Are there design guides, manuals, et cetera, to support it?
Good news is not only are there design guides, but the Federal Highway Administration has published one of those. I'll put the link in the box here. So in other words, the feds are saying, yes, road diets can be a very good solution for 4-lane roads. And the arguments boil down to this. One, it can actually be safer for motor vehicles. That left turn across 2 oncoming vehicle lanes, stopping in your lane, making people go around you, or getting rear-ended. We know there are a bunch of types of collisions associated with the 4-lane alignment. So there's plenty of traffic safety benefits, but then you get the additional benefits potentially of adding a bicycle facility, having a center lane that can have median islands for safer pedestrian crossings, having room for transit to access, or access to transit. So I'll put the link for that guide, that design guide from the Federal Highway Administration in the chat box, so that you guys can go to that. You should be taking that, because it is very possible, it's only been out in the last few years, it's very possible that local engineers don't even know of its existence, and so haven't heard those arguments yet.
Thank you so much. And next question is for Ken. Ken, when you discuss the traffic deaths, is this for pedestrians and bicyclists? Does it include vehicles?
So when I say something like 300,000 people will be killed on our nation's roadways in the next decade, I am absolutely including drivers and passengers in addition to pedestrians and bicyclists. Pedestrian and bicyclist deaths have risen much more than driver and passenger deaths over the last decade. And people biking, walking make up about 20% of all traffic fatalities right now. People outside of vehicles, including people on motorcycles, make up, I think, about 1/3 of traffic fatalities. But it's been since 1946 that fewer than 30,000 people have died on our nation's roadways. So when we talk about zero traffic deaths, we need to address the fact that we have people dying in large numbers every year. So we are a long way from zero.
Thank you so much. For Katie, the 125 million and 10 million that you talked about doesn't seem like enough. What would that cover?
So again, today we have 16 states that have resources to support the communities across their states and technical assistance to try to build the active communities we're all talking about. We are going to make it possible to move from 16 states to 50 states with those funds, plus support the $10 million for Active People Healthy Nation, which has allowed a team of national experts to support communities every day in being able to make these changes as well, and work in partnerships with those states CDC already funds to really give the capacity for communities to be able to make a lot of these changes locally. And Mark will tell you, so many of these changes are on the ground locally. And so, yeah, I don't ever think it's enough money for public health. If you look at chronic diseases overall, we spend 3.8 trillion treating chronic disease. And when I talked earlier about trying to triple the funding for CDC's chronic disease budget, we'd like to triple it to 3.8 billion, which is 1/10 of 1% of what we're spending on treating these chronic diseases in this country. So we need a lot more money for nutrition, physical activity, tobacco cessation, and the prevention and control of chronic disease, no question. So thank you for your question, and I hope you'll support our request for increased funding.
Terrific. So this is a question for Ken and Mark. One of the challenges we face advocating for better cycling and walking infrastructure is lack of data. Funding data collection on walking and biking trips, as well as better data on crashes, would be very helpful. We know that crashes with cyclists and pedestrians are significantly underreported. How do we address that?
I mean, I would agree with the question or comment. There is funding through NHTSA for reporting on traffic fatalities and serious injuries. They have some data and reporting about how crashes can be better reported. I think one of the things to keep in mind is, like Mark was saying, things like road diets are better for all road users. We know these things are successful and that they improve safety, and we kind of know the general context where they work well. So you don't need crash data. You don't need to have people injured before we can start improving our roadways for all road users if we know the type of conditions that can be improved upon. So I would hope that your local elected officials and your local engineers are looking to be proactive about safety and not so reliant on waiting for people to be crashed into and injured.
If I could, I'm going to build on that, Graham, if I may. There's a thing called the Manual on Uniform Traffic Control Devices. Some people in the question box actually alluded to this. You'll hear the acronym MUTCD, Manual on Uniform Traffic Control Devices. And it's the thing that says every stop sign should be a red octagon this size. In other words, it's the thing that standardizes all the traffic control devices that we see in our driving every day all across the country. The problem is it's really designed for automobiles. It's being updated right now, and there's an opportunity for all of us to weigh in on that. I would suggest that we should be asking for an update on that manual, because that's the manual that says, for example, we can't put a crosswalk here if we don't have at least 20 people crossing an hour during peak times. That's an example, and I'm just giving this as a very rough, and the point would be, well, why would people cross at a location that's very, very dangerous? Even if there's a neighborhood here and the one store that they can access for food here across the street, why is it that we need to wait till somebody's either been killed there or run over, or we've had a series of collisions, or we have people who are courageous enough to try to run across that road, and 20 people take their lives into their hands to get across, right? Here's the point. Why don't we all reach out and update the Manual on Uniform Traffic Control Devices to reflect a more human-centered approach that acknowledges that we've got to think about pedestrians, bicyclists, transit riders, and motor vehicles, and that the rules and the guidance to local engineers should have flexibility so they can respond to things like, what are the local land uses? Where is there a population that's got a lower rate of car ownership and therefore, as a result, might need better pedestrian and bike and transit facilities, even though they're trying to prevail against very challenging conditions now. The reason I say it is I put in the box the link to the Federal Register, and you can go in the chat box, you can go to that link and offer your comments. And even if all you said was, please rewrite the MUTCD to be more equitable, inclusive, and take into account pedestrians, bicyclists, and transit riders, as well as motor vehicles. Even if that's all you said, it would be a wonderful addition to the discussion on that topic right now. I hope I didn't go out of bounds on that, but it's a really important, it's a national guidance document, and it speaks to the questioner's very question.
Thank you, Mark. We have one more question for you here, and maybe time for just one more after that. How do we get young people more involved in this work, especially given the health statistics for those younger individuals, next generation folks?
The great question, and I've got to say, I think we must get them involved. I've had the great privilege of working with lots of young people in community workshops all over the country. We'll often, when we do a walk audit, invite kids out to very specifically tell us about their experiences. I'm working with some of the state alliances of YMCAs. The Ys are really fantastic because they convene youth, they really engage with them. In New York State, we're doing a tremendous program. The kids are called student ambassadors. They meet with us weekly. We are essentially training them. They're doing virtual walk audits, by the way, even during the pandemic. Last year, we did this all virtually. They went out and took photos. They created virtual walk audits. They invited local officials, planners, city councilors, departments of public works to join them on these virtual walk audits, and then made the case for improved crosswalks, better safe crossings near schools, things like that, completing repairs on sidewalks. I think youth voices are exceptionally powerful. It's very hard for local elected officials to ignore kids who are saying, I'd just like to be able to safely ride my bike to school. So I commend the questioner, and I'd like to say, I guarantee you've got local organizations like the Y that are ready to lead in that conversation with young people.
Thank you, Mark. Wanted to say thank you to all of the panelists that participated today, and thanks to the members of Congress and their staff for participating in the Physical Activity Challenge and supporting our asks on transportation, reauthorization, and increasing the CDC funding to support Active People, Healthy Nation, and for your time over the last hour.